I'm Dr. Philippa Woodward, and I am the lead GP of GPs at Prime Health in both Weybridge and London. And I'd like to introduce Dr. Sarah Maxwell to you. And today she is going to be telling us about the 12 gifts that we can give ourselves for Christmas in 2025.
Thank you, Philippa. Yes, I was really excited to give this talk, and Philippa asked me to think of 12 things that interested me and also with relevance to how we could help our patients at Prime Health. So on the first day of Christmas, what I would give to you or your family, Philippa, is the gift of a health screen, a full health screen, which we do offer at Prime Health. My favourite one is the executive health screening package because we get a whole hour to do it. And what I think is great about the Prime Health screening packages is that we can really focus this into whoever's sitting in front of us, you know, on your age, your sex, if you've got any particular interests or niggles. We've got that full hour to dive in on that one, and also do a general health check. So you'll have a long time to talk to the doctor, examined head to toe, full set of bloods, a chest x-ray, an ultrasound scan, and then a follow-up appointment to go through all the results in detail. And I would say that the patients that come for this found this really helpful and useful, and doing it at the start of the year or just after Christmas will give you a real focus in on what to do for your health in the coming months.
Excellent. So for your second day of Christmas, what would you focus in on to give your patients?
So I would focus in on the heart this time. I would say the commonest age group that come to us for the heart health check would be the 45 to 65 age group. We're more than happy to do them on any age, but I think this age group we can add a huge amount of value by targeting some of the health screening on the heart. And here we look at the major risk factors for cardiovascular disease. And blood pressure is, I would say, the main one, closely followed by cholesterol. But high blood pressure can be lingering in the background. You don't know you've got it, and that is something that we can really dive in on, do the additional workup that's needed if your blood pressure is high, and give you tailored advice on management, whether that's lifestyle changes, whether it's drugs, and going forwards from there.
And of course, we're lucky enough to have CTCA at Prime Health, aren't we? Which is the CT coronary angiogram. Do you want to tell us a bit about that?
Yes, certainly would. So CT coronary angiogram is a test where you go through the CT scanner, and it gives you three main things that it looks at. The first thing is your calcium score, and then it will compare that to the typical person of your age and sex. And this can be a marker of whether you are starting to develop furring up of the arteries or whether there's none at all and all is looking great. The second thing this scan does is it looks actually at the individual coronary arteries and looks to see if there is any plaque development. And plaque is the furring up of the arteries that over time can lead to heart disease. And the third thing it looks at is the inflammation marker down the heart. So if we decide that somebody would benefit from having that scan, it can really give a great assessment of heart health and can really help us tailor our advice on management of risk factors going forwards, or indeed whether you need to then get specialist advice from one of the cardiologists that we link up with.
And of course, it's that inflammation, isn't it, that gives us the earliest warning signs of heart disease and informs the sort of the Caristo bit of the scan, which is pretty
That's
unusual.
Right. Yeah. It's fascinating reading the reports, actually. Yes.
For the third day of Christmas, what would you focus in on?
So the third thing I want to talk about and give you as your Christmas gift is having your lipoprotein little a level checked. So this is all linked in with what we were just talking about with respect to heart health. And I see it as an important risk factor modifier. So for example, if the doctor tells you, look, your blood pressure's a bit high, your cholesterol's a little bit high, you might want to think about taking a statin. But if you're not sure about that, we can look at these additional risk factor modifiers. And lipoprotein little a is, we all have a level in our blood that's genetically determined and doesn't tend to vary. And high levels can really put your risk up independently of cholesterol. And if you are unlucky enough to have a high level, that may focus in your thoughts to either, do I want to medicate my cholesterol, or do I want to look further and get this CTCA that Philippa just mentioned? Similarly, if you have a nice low level, that might help support your decision just to stick with a nice healthy lifestyle and not go for medication.
Excellent, thank you. For the 4th day of Christmas, we're moving to a different organ. Tell us what you'd give as your gift for the 4th day.
So on the 4th day, we are looking at our liver health. It is the risk factors for fatty liver, the new term for this is MASLD, metabolic dysfunction associated steatotic liver disease. And this is the commonest liver condition seen in the UK, and the levels are going up fast. And it's very much linked with metabolic ill health, so the other things, obesity, type 2 diabetes, and then there's this thing that we call the metabolic syndrome, which is various factors. And I do like to focus in, when we do the health checks, or even in normal GP appointments, talking about liver health with people. It's quite common when you get bloods done that one of the liver blood tests might be a little bit elevated, and then we will take that further with you. Sometimes we need to do an ultrasound scan to look at fatty change in the liver. Sometimes we need to ask you to lose weight, and we can also help with that. And sometimes we need to get further tests done on the liver, and there's a specialised scan called a fibro scan that we can arrange for you via one of our specialist liver consultants.
Excellent, thank you. For the 5th day of Christmas, what's your gift? Something completely different.
Yeah, so we're going completely different tack now and talking about vaccines. I think looking at sort of population health, longevity, one of the real things that makes a difference is the level of vaccination, the levels of diseases we can vaccinate against. And one of the newer ones that's come to the UK in the last 12 to 18 months or so is vaccinating for RSV, which is respiratory syncytial virus, which is one of the usual seasonal viruses. It's not a new illness, but it can cause really severe illness in older people and in very young babies. So there's a widespread NHS programme to vaccinate pregnant women and the 75 to 79-year-old age group. But obviously you might not fit that age group, you might be 80, 81 and want to protect yourself as well. And that's something that we can help you with here at Prime Health.
Excellent, that's good news. Now, for the 6th day at Christmas, this is one geared towards the ladies, isn't it?
It is. So we're going to talk about menopause. We are very lucky at Prime Health to have a 30-minute appointment, so it gives us all the time to talk about whatever you've come with. But if you want to come and talk to one of us about menopause, perimenopause, we can go through everything in good detail. You obviously have all the typical symptoms that people know about, changes in your cycle, the hot flushes, but there's other more subtle symptoms, and lots of people complain of something called brain fog, cognitive changes that can really be quite frightening in this age group. And there's lots of research going on showing how the brain patterns, the brain function changes in menopause. And whilst it wouldn't be a reason on its own to have HRT, it's certainly something that lots of people notice that can improve once you start treatment for menopause. Sharpness, brain power, along with helping the traditional menopause symptoms. And that's something that we do really enjoy going into and helping women in our day-to-day consultations with this, I think. Would you agree, Philippa?
Absolutely. Very, very, very important to get it right. It can last a long time, and it can be very, very impactful on a lady's life at a time when she's often really busy with children, parents, husband and work. the 7th day of Christmas, what would your gift be?
So linked in, it's bone health. It's something I'm a little bit obsessed about, which if any of my patients are watching, they may know. But bone health at menopause is a real thing that I think we should get right. We are living longer and longer, and for me, it's really important that we age in good condition. And the fragility of bones once the menopause has happened is something that we can look out for, we can monitor, and we can treat. As soon as you go through menopause, there's a gradual loss of bone density. So the way we approach it is talking about a bone health assessment as part of menopause, age of menopause, if there's any family history of osteoporosis. And we can then look further at that by organising a bone density scan and talking about treatment options. We should all be taking vitamin D, whether we're menopausal, male, female, or whatever, but we would tailor the advice to you. And even if no treatment's needed, I do think it's really important to keep an eye on bone health every few years as we go through our 50s, 60s, and beyond.
Yes, and of course that's something that also affects the men if they're in specific risk groups, like being on steroids, isn't it?
Indeed. That's very much true, and we probably don't think about it so much in men, but you're absolutely right, Philippa. It's something we should be more proactive about as well.
Okay, moving on to your 8th day of Christmas, one for everybody.
It is one for everybody. It's sleep, and I actually really enjoy sleep consultations, especially at Prime Health when I have 30 minutes, because we can do quite a lot here actually, and it's not all medication, but it's so important to get it right. It's not just rest and relaxation, it's your brain resetting itself. Poor sleep can raise your risk of heart disease, depression, diabetes. So the approach here really that we would do, I think, is sort of trying to find out if there are any underlying medical causes for poor sleep or something going on in your life, and looking on at that, and then looking at any medication ways that we can help, or directing you with cognitive behavioural therapy, sleep focused CBT, either in person or via various apps, can also be really helpful as well. There's a newish drug on the market called daridorexant, which some of my patients have had great success with. And in the 55s and over, there is also the licensing for a trial of slow release melatonin as well, which sometimes is appropriate.
Excellent, thank you. The 9th day of Christmas, something that
so moving on from sleep onto headaches in particular. Migraine has had a change in treatment in the last few years with a new class of drugs being introduced in the UK. The rimegepant is one of them, and it works on a different pathway to all the other drugs. So it's worthwhile being aware of this if you are a migraine sufferer, getting lots of migraines, treatments not working for you. Please do come in and have a chat with one of us about it. Similarly, if your headaches aren't migraines but just headaches, we do have the 30 minutes to go through it in detail. Most headaches don't need a scan. Some headaches do need a scan, and we're fortunate enough at Prime Health to have quick access to both MRI and CT if a scan is wanted or needed.
Good, thank you. Now, for the 10th day of Christmas, maybe one for some of our younger patients.
Yeah, acne. It's pretty close to my heart, actually. One of my boys had quite severe acne, and it can go on for ages and not be treated well, either because of sometimes a lack of awareness of what's available, too much focus maybe on facial treatments, beautician treatments, when actually the teen actually does need some treatment. The other thing I see sometimes is a fear of coming to the doctor for treatment because of worries about what we might recommend, particularly Roaccutane, the very strong treatment. But I would say that most teen acne we can get under control in the GP surgery, but we will know if it's one that does need the dermatologist as well.
Excellent. And of course, the dermatologists are now also, for those who maybe did leave it a bit longer than they maybe could have done, are really good at treating scars now as well, aren't they?
Exactly. Yeah.
Worth coming in even if maybe you've already got scarring from it. Okay,
yeah.
Good.
Yeah.
On the 11th day of Christmas, our gift is something very exciting. Would you like to tell us about that?
Yeah, so not particularly relevant to general practice, but to medicine as a whole. Some of the great breakthroughs that we've had in the last 10 years with cancer treatment, in particular immune therapy, which has turned some terminal cancers into treatable chronic diseases. And it's just more of an interest factor, this one, into the wonders of modern medicine. And whilst obviously we're not going to be giving you that from the GP surgery, we can connect, if you are unfortunate enough to be unwell with cancer, we can advise and connect you with top oncologists. And also we're well aware of the new treatments, side effects, and can help support you in a more holistic way through the cancer pathway. But yes, it's a game-changing treatment. Yeah.
It is. I'm sure, for those of us who are a little bit more mature, illnesses that people historically just automatically were never going to survive, they're now living with. And it's very exciting.
Exactly. Living and working and living normal lives with. Yeah, it's wonderful.
Okay, now, finally, the last gift, your 12th day of Christmas, something we really can help with.
Yeah, so I wanted to just wrap it up with the role of the GP. I think sometimes it's so easy not easy necessarily, but the natural inclination of some people is to see a specialist for this, a specialist for that. And I really wanted to sort of bring it back to the holistic role of the GP. Whilst we're not specialists, of course, we are specialist generalists, and we hold it all together. We listen, we look after you through the ups and the downs, we understand the family situation, and the evidence does show if you're seeing the same doctor regularly, it is very much better for your long-term health, particularly in the older population as things start happening health-wise. So, and we're probably one of the few last generalists available in the medical world these days, given that people get super specialised from a very early stage in their career. So we don't have every answer, but we do know where to find it.
And we can build fabulous relationships, can't we?
We can.
Longer. So yes. Yeah. Oh, well, that was brilliant. Thank you so much. And I guess the last thing to say is, after all these lovely gifts of Christmas, is to wish everybody a very happy Christmas and a very healthy, hopefully, 2026.
Indeed. Merry Christmas.